a quick fact on obstructive sleep apnea. Very interesting topic. And then question on this is straightforward. If you know it, you know it. Usually will be in a SATA form. So let's get to it. So what is the obstructive sleep apnea? This is usually it happens mostly at night. And so there is a pathophysiology associated with that. Like I told you guys every day, pathophysiology. If you know the pathophysiology, you can figure out what is the problem. So these people, they have airway obstruction. So airway obstruction, when they are asleep, is because the pharyngeal muscles basically relaxes. They don't do what it's supposed to do. So the pharyngeal muscle relaxes. And what it does is it causes airway obstruction. So how will these people do? During sleep, they will have apnea. I mean, it can last for like more than 10 seconds. So that's the criteria. And then throughout their sleep during the night, 50% of them is less than normal, like normal sleep. Like you sleep, most of your sleep is more than 50%. You sleep normal, you don't have to wake up, no apneic episode. But these people, less than 50% of their sleep basically is they undergo normal breathing. And so it become a problem. Imagine you sleeping throughout the night and you're waking up multiple times at night because of the apnea. Because of the apnea, they wake up and they will be choking, they will be gasping for air. And the reason why when this happens, their CO2 is very high. So they retain CO2. So if you check their PCO2, is high. So they are respiratory acidosis. And this is very important. If you have to give these people pain medication, you have to know because they are in respiratory acidosis. So how will doctors diagnose them? There's an easy way to remember it, and that's what we call stop bank. Okay, so stop bank means that is the easy way you can screen them. Most people go, they want to get a sleep study. The doctor will do a certain quick study, and this is very quick. It's a question you ask them right away. It's called stop bank. And the first thing is the snoring. You ask if they're snoring. Second, you want to know if they're tired during the day. So because they don't sleep throughout the night, they're very tired during the day. And then the O is basically somebody saw them snoring. So the wife usually or the husband will see them. So some of the observe apnea episode or sleep and snoring. But the most important, somebody observe you, stop breathing, and they wake you up and you start breathing again. The P is usually because of the changes in the hemodynamic changes, especially respiratory acidosis and obstruction that occur, it can increase your blood pressure. So blood pressure, they may have some blood pressure issue already undiagnosed. They don't know about it, but it's snoring. And the B is a BMI. It's usually obesity, so greater than 35. That's the BMI. So somebody who is overweight. And the A, unfortunately, the older you are, the more likely you're going to get it. So greater than 50 years old is a risk factor for that. And the N is, because of their BMI of greater than 35, you expect their neck to be bigger. So they have great neck at least 17 inches. So that's big neck people. And the G is basically shows the agenda. So this is the agenda. And usually male sex is greater than female. So more male get it than female. So this is the easy way to remember sleep apnea. If they give you a SATA question, just remember stop bank, snoring, tired during the day, observe somebody saw you that you snoring or you have apnea, their blood pressure is high, their BMI is greater than 35, their age is over 50, 17 inches neck, and they are male. So stop bank, easy way to remember it. So what would you do? Okay, The common symptoms that you see in these people is they can't concentrate, so difficult concentration. So these are the symptoms. So difficult concentration. They can't concentrate because they can't sleep during the night. When they wake up in the morning, they have headache. So morning headaches. Okay, they have morning headaches. And during the day, because they did not sleep the night, so daytime sleepiness. They start sleeping during the day most of the time. They'll be driving and then they will stop when they at the traffic junction, they will stop and they'll fall asleep. And so that's a risk of car accident and it's a problem. Even at work, they can't stay awake. They're working and they start sleeping again. And so that's bad. Because they can't sleep, well, you get tired. That's why we all need to sleep at least 8 hours a day to ensure that. And your concentration is all affected. So, and they snore, of course, snoring. But just because you snore doesn't mean you have sleep apnea. It's a very important thing. You should make sure you don't just consider that as their sleep apnea. So, what do? You have to treat them. First, diagnosis. Okay, and the common study that you do is called sleep study. In your test, they will write some fancy word for you. It's called polysomnography. That's what it is. That's the study. It's a sleep polysomnography. It's a study that they do for sleep study. If they don't write sleep study, they will write this fancy name polysomnography. It's basically they will take them to the hospital. They sleep throughout the night. They have electrode placed on them to see how they're breathing, their apnea episode. So they calculate how many apnea episodes, how long it lasts, how many normal sleep, and you're snoring. And so then they can calculate and make a diagnosis. If they treat you and you have that problem, well, you need CPAP at night. So CPAP at night when you sleep. Um, then you got to, and then this is where you, the nurse, come in. Okay, you come in, and then you have to teach them. This is what they have to, the question they can ask you. So we've made all the diagnosis management in your test. You got to every disease process learn how to teach them education, because when they then give you a SATA question, it will be education or risk factors. These are the risk factors of it. So this is a SATA question. They can give you risk factor, and this education and teaching. Okay, education and teaching that you have to tell the patients. That's a SATA question right there. So they should avoid sedatives. So alcohol is a sedative. So when you sleep, then it can make them more sleepy, and then it can obstruct their airway because they already sedated. It's not good. They need to lose weight. That will help their neck and circumference and their BMI, and that will decrease the episode of that. They should avoid sedation, like I said. So this is a patient in the who do you see? It's a classic who do you see first. They can tell you somebody just had surgery, he had a sleep apnea, is asking for pain medication or he needs pain medication. Do not give that guy pain medication right away without not assessing them. There are risks of obstruction. If you give them opioid, they will obstruct. So you got to be careful and then see them first and assess their respiration before. You may try other medication, but anything that will lower their respiratory drive is bad. So you may say avoid opioid in them. Even though they can get it, you got to be extra careful. So extra careful with opioid when you're giving them. Okay, so you got to tell them to do that. The we can help these people. Sometimes there's a medication that we can give them stimulant. They can stay awake during the day. They can stay awake. You give it to them during the day, so they can stay awake during the day and they can do their normal function. And that medication, you can even use it in a narcolepsy, people who just fall asleep and then fall down. So you can use it. That's Modafinil, and that medication is Modafinil. You should know this medication. We give it to them so that they stay awake during the day, but don't give it to them at night. If you give it to them at night, then they can't stay awake and sleep anymore during the night. So give it to them during the day and avoid it at night. The key side effect you should know is black tarry stool. So if they have black tarry stool, they're bleeding from that. This medication is bleeding. It's a stimulant, so you can see, it can keep them awake. It can give them tremor, like any other stimulant, like amphetamines. They can do the same thing. So what teaching would you do with this medication? Something that is stimulant will avoid caffeine. No caffeine at all, because then that will keep you awake forever. Okay, that will keep you awake forever. And so this is the quick brief about the whole thing. Obstructive sleep apnea, a very good topic you should know, and this medication side effect, how to teach them, how to diagnose this, and the risk factor. So you can see this is a SATA question, this is another SATA question, this is another SATA question. This is the knowledge base. How do you diagnose it? Sleep study or polysomnography and a sleep at night, CPAP at night. So that is, let's see if we can complete this with a quick SATA question. So which of the following will ensure the study being approved by the nurse? So you read the last portion and you read the first portion. A client present to the PCM requesting polysomnography as request from a spouse. So the spouse tell the patient to go and get a sleep study. That's all what it means, sleep study. So which of the following will make sure that the study is approved? You usually don't get it unless it's approved based on your symptoms. So we're going to screen them. Systolic blood pressure of this, yeah, he has hypertension. So that's one of them. BMI of 30, no, it has to be greater than 35. So no, this is right. So this is wrong. Cannot stay awake during the day at work. Yeah, daytime sleepiness. Wife wears headphone to sleep. Basically, so if the wife is wearing headphone to sleep, that means somebody is snoring. There's too much noise in the bedroom. So that's the way you can infer. Wakes up multiple times during the night, during sleep at night. Yes, that means he's snoring and he's having apnea. When you have apnea, usually you stop breathing and you wake up and you start breathing again. So that's good. Feels tired during the day. So that's good. So once again, stop, bang. Key for obstructive sleep apnea. A priority patient, don't give them opiate and watch them carefully. Thank you for listening and have a great day.